Okay, hey everyone. I'm gonna talk a little bit about what makes a good hospital versus a bad hospital, specifically the emergency department. It's kind of the only department I've ever worked for in the hospital. Um, Never worked for any other like units, ICU, med surge, any of that other stuff. So this is all about the emergency department, which luckily enough is what most people only really go to the hospital for. A lot of times they're not even admitted. There's in and out of the ER. So I'm gonna talk based off like the factor of patient care. I guess there's like other things you can rank the hospital by. Um, I guess however much like research they develop, or you know, pay, staffing, all that stuff. Like, no, none of the patients really care about that, and I just want to give you guys a little bit of insight on like how patient care is affected. And how you can go online and tell if your hospital is good or bad. I was watching a video just recently about private equity taking over emergency departments in the United States. I've known about this for like a long time. Dr. Glockenflecken did a lot of comments about private equity and acquiring emergency departments. There's like a physician group that's like suing a private equity company. I think that's like owned by BlackRock. That's a private equity. They're like suing BlackRock because like they're basically non-doctors making patient care decisions based off like if the insurance is going to cover it or anything. It kind of in the nitty gritty, but the whole thing you just got to know is usually private equity companies that own emergency departments, immediate red flag, bad. I'm not saying that they're all bad, but I'm kind of saying that there's a strong correlation with emergency departments sucking and being owned by private equity. That's just because any hospital that's like trying to make money is gonna understaff the department really badly. Just to make as much money as possible, they're gonna try to have as few people working as possible. Try to control their expenses that way. So, probably the best way that you can figure out if your emergency department is bad or not is you go on Google, you look them up, and you look at their revenue. If they make money, it's not a great sign. If they lose money, that's a great sign. Usually hospitals that lose money have really good patient care and like really short wait times. I think the wait time is probably like the biggest thing that are affected by like being understaffed and like hospitals trying to make money. The first two hospitals I worked for, they were private. And this third hospital I'm working for is also private, but they're also nonprofit. So even if they made money, it's not like they have shareholders to profit share with anyway. Not so much for the first two hospitals I worked for. Anyway, those hospitals made money. And they were, the first one wasn't that badly understaffed, but the second one was terribly understaffed. I had a terrible experience working there. I was doing a lot more than my job title, was written down, like on my job title. So yeah, they both made money, those first two. This third one I'm working for loses money. And how does like a hospital lose money and not close down? The government has given some money, grants and whatever, to the hospital so that they don't close. A lot of hospitals rely on donations too. The major research centers in Los Angeles, I'm talking the ones associated with USC and UCLA, they're usually they also lose money. LA General, formerly known as LAC USC, that loses money, and it's the busiest emergency department in Los Angeles. I believe both Los Angeles County and Los Angeles City, although I'm not 100% sure about the county. It's definitely the busiest in Los Angeles City. So and also UCLA. They got a couple very busy hospitals as well. That's where a lot of the research comes out of, because those academic centers, they've got access to residents, physicians, of course. They have the med schools who have the med students, and the teachers, a bunch of faculties, in order to produce a lot of research. And LAC USC, also known as LA General, they lose money. I'm not exactly sure what the biggest UCLA hospital is. It might be Ronald Reagan. They also lose money. But they also have like very wealthy alumni donors, and just like people in general who just like want to give them money. So they're actually like very nice hospitals, and the wait times are very short. Their staffing's really good. I've never worked for either of those hospitals that I just mentioned right now, but very good hospitals. Yeah. So usually hospitals that make money, they have really bad wait times just because they're super understaffed, and they're usually kind of like difficult to work for. They try to cost cut at every corner, so it gets a little janky. Sometimes the hospital is just like out of stuff. Like sometimes there's like, nationwide like medication shortages and stuff like that. It's tough. But also like sometimes the hospital just needs to, take their purse out, open up your wallet. Let's buy some medication. Let's restock. Let's get some stuff going, Open up your purse. And yeah, I mean, it's really nice to work for a hospital that has like short wait times. I mean, not that the patients appreciate it, actually that's not true. I think the patients complained a lot less than the the second hospital I worked for had terrible wait times. I'm talking 8-hour wait times for like abdominal pain. You come in, you get your CT scan of the abdomen, all this stuff, but the doctor has to like read it, and then they have to have a nurse, and then they have to like give you an IV, and then the doctor has to give you your results. And because like there's no nurses there, because we're so understaffed, the doctor can't like give you your results and all that stuff and discharge you and give you your medications and blah, 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 because there's not enough nurses. So even if we have like a bed, there's not enough nurses because there's like ratios and laws. Nurse can only have 4 patients. Anyway, what I'm trying to get at is that the wait time was terrible because we're super understaffed. And, hospital made a lot of money, So, yeah. Anyway, the patients here at my hospital I'm working at now, they still complain all the time. Like, oh, I've been in the hospital for like 1 hour. Oh, I've been in the hospital, or I've been in the waiting room for 2 hours now. And, of course, we want to be respectful of everyone's time, but I mean, this is like some of the best wait times you're going to get in the city of Los Angeles. You're in the waiting room for an hour. You're in the waiting room for 2 hours. Like, yeah, that's good. If you get in and out of the emergency department in under 3 hours, you're like, that's like amazing. Usually it's like an all day affair. Especially like some of these other hospitals. Like I've seen wait times like 10 hours, 12 hours, 14 hours. And that's like, sometimes they're understandable. Like the patient has to get transferred to another like hospital, but we can't find another hospital that will accept them because, I don't know, their insurance is bad, or it'd be like really expensive to treat them. And I don't know. Like I don't know the upper management things going on at hospitals. But yeah, sometimes it's just, you can't find like a place, like, sometimes like psychiatric facilities, we're trying to find a psychiatric facility to send these patients to, and, none of them will take them, one case in particular, patient was a psychiatric, but they also needed, like medical, like that had like medical capabilities as well. The patient was big into swallowing like objects as a way of like hurting themselves, and they had recently like swallowed blood pressure cuff. Anyway, that's the reason why they needed the medical part as well, because in case something went wrong with their stomach, their intestines or whatever. So it was really hard to find like a psychiatric facility that also had like medical. That's the point. So I'm trying to get at. Sometimes it's hard to transfer them. So that patient was like in our emergency department for like 48 hours. That's like more understandable. But usually, whenever you come to the emergency department, there's like three things. You admit them. That means they go upstairs and they stay a couple days. You get appendicitis, you get admitted. You might get surgery. Sometimes they take the appendix out. Sometimes they can get treated with like just medicine, like antibiotics. This is not medical advice. Anyway, yeah, that's just like an example. So ADT, that's the way I remember. You either get admitted, you get discharged, or you get transferred. When I was like unit secretarying, I would always I have on my resume, I was in charge of like ADT tracking. Anyway, discharge, usually that's like what happens. You go into the ER, they give you some medications, whatever. Say you came in for like chest pain. If you pass all these tests, and you not like have that many risk factors, they're not going to admit you. You get discharged. Yeah. People come in for like the common cold all the time, and we just give them some medications, then you get discharged. We're not going to admit you for the common cold, to be a waste hospital resources, and it's not like we have a cure to the cold anyway. The common cold, at least, like the virus. And then transfer. That, like I was saying before, transfers can get really complicated. Sometimes they can be really uncomplicated. Someone's having a heart attack, not complicated at all. We actually call 911, and then usually the fire department comes, and then we transfer them to what we call a STEMI center. They have like a cardiologist that can put it's called a stent, but it's basically like a wire that they put in your like heart, in one of like the blood vessels, and then they can the wire opens up, and it can like stop the heart attack or restore blood flow to where the blood wasn't going. Anyway, that's like a big complicated way of saying there's a lot going on in the emergency department, and how much profit driven the emergency department has a huge effect on wait times. And I think wait times are probably the biggest thing that hospitals can have control over. If a hospital's super profit hungry, then they're going to do whatever they can to cut cost, which is going to sacrifice patient care. And it just, is what it is. It also has to do a lot with what area the hospital is located in. If people in the area are don't have really good insurances, or they're all Medicare, Medicaid. Those are the government insurances. Medicare goes to old people, Medicaid goes to poor people. The reimbursement rates aren't that great. Medicaid especially. The poor people insurance. Sorry to put in such bad terms. If you make under a certain amount of money, you get Medicaid, and the hospitals don't get a whole lot of money from Medicaid, the reimbursement rates. So if you're in a poor area where everyone has Medicaid, the hospital's not going to make that much money. Anyway, yeah, so you'll see hospitals in really nice areas. They're really nice, so that has another thing to do with it. It's not just if the hospital makes money, it's good versus bad. Okay, bye.